Hello everyone, and welcome back to Help Me GMP for your weekly dose of good manufacturing practice, advice, tips, and guidance. In our last episode, we discussed training and competence within the quality management system. Today, we'll be focusing on another critical component, change control. Let's get started. Change control is a systematic approach to managing all changes made to a product or process. In the pharmaceutical industry, change control is essential to ensure that any modifications do not compromise product quality or compliance with regulatory requirements. It helps maintain the integrity of the quality management system by ensuring that changes are evaluated, documented, and approved before implementation. Let's break down the key elements of change control. Number 1, change request. The process begins with a change request where the proposed change is documented, including the reason for the change. Number 2, impact assessment. An impact assessment evaluates the potential effects on product quality and compliance. The number of impact assessments required will depend on the type and extent of the change and could include impact assessments by various teams, including production, quality control, engineering, regulatory affairs, and of course, quality assurance. Number 3, change approval. Once all required impact assessments are complete, the proposed change is reviewed and approved by the quality assurance team. Number 4, implementation plan. Once approved, an implementation plan is developed with SMART actions, that is, specific, measurable, achievable, with responsibilities defined and timescales allocated. Number 5, documentation and communication. All changes must be thoroughly documented and communicated, with evidence of completion of each step added to the change record. It is likely training in a new process will be required, which should be recorded within the quality system. Number 6, implementation. Once all pre-implementation actions are complete, the change may be implemented. Number 7, monitoring and review. After implementation, the change is monitored to ensure it achieves the desired outcome, and there have been no deleterious consequences of making the change. The effectiveness of the change in achieving the intended result may also be reviewed. Change control is vital for several reasons. Firstly, it ensures compliance by making sure all changes are evaluated and approved, maintaining alignment with regulatory requirements. Secondly, it helps maintain product quality by assessing the impact of changes and implementing necessary controls. Thirdly, it identifies and mitigates risks associated with changes, ensuring they do not negatively affect the quality management system. Lastly, it supports continuous improvement by allowing organizations to make necessary changes in a controlled and systematic manner. Effective change control is essential for maintaining a robust quality management system and ensuring the quality and compliance of pharmaceutical products. Thanks for tuning in. Be sure to like, share, subscribe, and hit that notification bell to be kept up to date with more great content. Until next time, stay dedicated to quality and keep learning.